Welcome everyone. Thanks for joining this meeting with us today. This space is available for us. Thanks for the Academy of Microscopic Enhanced Dentistry. This institution is a structure for providing continuing education, looking for the best interest of dentists. And they are providing the tools for making the process of integrating a microscope into the dental practice more smooth. And the space is also provided by Seiler Microscopes. We will talk about 3D microscopy today. And I can see that my good friend Jim is here. Welcome, Jim. It will be a pleasure to have you here during this meeting. For the next 1 hour and a half or 2 hours, we will see why the implementation of microscopy into the dental practice is advisable. We will analyze the differences between regular microscopy and 3D microscopy, and we will see some clinical tips and tricks for making you guys to overcome the learning curve with the 3D microscope easier. The 3D microscopes have many advantages. It's an excellent tool when the dentist wants to incorporate this type of magnification for doing not only endodontics, for doing any procedure in dentistry, because you will see all those advantages. Okay. If you guys have any question during the lecture, please use the chat, and I will try to check the chat from time to time, and we can solve the doubts during the lecture. We do not need to wait until the end of the lecture. So some of the videos that I will play have music, so you will hear some background music during the videos. So you already know that, and let's start with this. Okay. So the first thing, I'm sharing the screen with you now. The first thing that we need to understand is that microscopy is not only for endodontics. Microscopy can be applied in any area of dentistry, in restorative dentistry, prosthetic dentistry, in periodontics, and aesthetic dentistry as well, because we will obtain a better understanding of our operative field. We will have a better vision, we will have magnification, we will be able to have a more precise performance during our treatments. And it's the first thing that we have been working on since a few years ago, trying to transmit this idea, because it is true that endodontics is the specialty in what the microscope was introduced in dentistry, because working inside of the root canal system is not easy. I'm an endodontist, but my clinical practice is not only focusing endo. I also do some restorative and some prosthetic procedures. And when the time of working in the most posterior areas for preparing a tooth for a crown, for example, the visibility in that areas might be compromised, and the illumination and the magnification that the microscopy can provide are essential tools for having a reliable clinical practice.
I got a song filled with shit for the strong-willed. When the world gives you a raw deal, it sets you off till you scream, piss off, screw you. When it talks to you like you don't belong, it tells you you're in the wrong field. When something's in your mind, I'm calling for you, because it lets on to you like Knock, knock, let the devil in, malevolent as I've ever been. Head is spinning, this medicine screaming, dick, 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 medicine, dick, dick, like a silent ball, Edgar Allan Poe, written should have been dead a long time ago. I got that. Ready to stab it. It's time when I got that. Ready to stab it. It's time when I said, knock, knock, let the devil in, shotgun, pip, pip, balancing the belt pin, hot, fuck around and catch a hot one. If you trap it in, I'm not done. Fix man and Mr. Thought. I got that. Ready to stab it. It's time when I got that.
So as you were able to see during this video, I showed you many procedures, most of them surgical procedures. And the 3D microscope, it's a clinical tool that will show you the best characteristics during surgical procedures and during operative and prosthetic dentistry. Why? Because the 3D microscope will provide you guys freedom of movement during the treatment. We have in our offices more than 10 years of experience working with microscopes. We are located in Guatemala. Guatemala is it's a country located in Central America. And in this slide, you are seeing some pictures from my country. We are well known for being the land of the Mayan civilization. We have a lot of volcanoes, active volcanoes. You can climb a volcano and see lava coming out from the volcano very close to the cities. It's not far. And we also have the Atitlan Lake, which is the most beautiful lake in the world, according to National Geographic. So if you want to come to Guatemala, you are very welcome to join us. I mentioned the Mayan civilization because the Mayas, the Aztecas, the Incas, the Egyptians, all of them are well known because of the advanced architecture techniques that they used to have, but they also perform some dental modifications for showing the status, the social status on the people. And it's very interesting to see the skulls and the teeth of the people from that time, because you can see very specific and very well-performed modifications in the anatomy of the tooth. And that's what we are looking for. We are looking to be precise and to provide to the patient precise and beautiful treatments. By that time, we still don't understand how they perform this type of procedures. But nowadays, we have a lot of technology that might help us to provide reliable treatments to our patients. Thank God nowadays we are not working in this way. We have a lot of technology that makes our clinical life much more easier, more enjoyable, which is an important part because I love what I do. I really enjoy when I have to work all day long doing dental treatments. I do not feel stressed because I enjoy my work and my job and what we do. And for having this type of enjoyment, it's important to feel comfortable. If you are not feeling comfortable during a treatment, it will be stressful and definitely you are not going to enjoy your profession. Because of that, since the very beginning in my clinical practice, my objective was to have a clinical practice focused in microscopy. I wanted to have a microscope in every chair. It was our objective, my wife's objective, and my objective, because my wife, she is in charge of the prosthetic procedures here in the office. You can see the setup in one of our operative rooms. And nowadays, we already achieve our objective, and every dental chair have a microscope. We do everything under the help of magnification of the microscope. We have 3D microscopes, and we have regular microscopes as well. And we do everything under the help of magnifications. If we do a prophylaxis, for example, we use the microscope. If we do a surgery, we do the microscope. We do everything under the help of the microscope. Of course, it's not easy to get used to the microscope when you have to prepare a tooth for a crown, when you have to do surgeries. It have a learning curve that is necessary to overcome, but when you have the appropriate guidance, that learning curve is most easy to, it's easier to deal with that part that we need to dedicate to enhance our abilities working with the microscope. Because of that, we decided to open a small clinical training center here in our office in Guatemala City. We provide personalized courses related to how to use the microscope, related to microsurgery, related to updates in endodontics, in vital pulse therapy. We feel very, very blessed because we have had students from all Latin America, from El Salvador, Nicaragua, Honduras, Mexico, Dominican Republic, and we are trying to help the dental community to understand all the benefits of the microscope in dentistry, and to help them to overcome that learning curve that most of times tends to be a little bit frustrating and stressful, mostly with the regular microscope, because the regular microscope, it's kind of difficult during the first days working with it, and we will see why. During this video, you will be able to see how we change the clinical scenario in what we have a very destroyed and affected upper molar. Actually, that upper molar was sent for extraction by a colleague, and the patient came to us for a second opinion, and we explained to the patient that maybe we can do something to save that molar. You are seeing all the process in what we went to have a totally non-restorable tooth to a clinical situation in what you can think, okay, that tooth is possible to be saved. And we were able to save that tooth because of the help of magnification. So what we want is to provide help to our patients. You can see that we were able to clean the root canal system. We were able to reconstruct that molar. We had in mind what final restoration we wanted to place into that molar for protecting it. And with all the adhesive techniques that we have nowadays, we have reliable adhesive techniques. We are not doing a full coverage crowns, for example. We are trying to do some incrustations, overlays, inlays, trying to maintain as much as possible healthy dental structure. and we were able to work with that patient, and we were able to take her from a clinical situation like the one that you are seeing in the left side of the screen to a clinical situation in what you can see a restored tooth that it's in mouth already for 6 years, and it's working perfectly. Because of the help of the microscope, I was able to take pictures, to record the videos, and I were able to get all that digital material for showing that to you now. Most of us in this meeting, we are related to dentistry. Some of you, maybe you are students, you are clinical practitioners already, maybe some of you are related to sales. But it's important to transmit what we are doing to the patient, because when you explain with pictures and with videos to the patient will trust you. You will increase the rapport with your patients, and your patient will become a loyal patient that will stay with you for a lifetime. If we are performing good treatments, the patient will like to stay with you as your main doctor, and they will tell to the family members, friends, and all the people that you are a good doctor, because you explain everything what you are doing, and you are showing to the patient, which is a good part of the advertisement that we can do about our office. If we analyze these pictures, maybe some of you already have an idea related to some diseases that are present in these patients. You can see that there is maybe some gum inflammation, maybe some plate retention in some areas, maybe caries, maybe some non-well adapted obturations. And we already have an idea because we already have the clinical experience for trying to understand what is happening there. But if I give you colors, it's more obvious what is happening in each picture. Something like this happens when you change your dentistry from a regular dentistry to a clinical practice in what the microscope is helping you. You will have a better understanding of what is happening in patient's mouth, and having that understanding will help you to have a more precise diagnostic process. And if you have a good diagnosis, of course, you will have an appropriate treatment plan. If we have a wrong diagnosis, our treatment plan will be wrong. So it's important to have all the pieces of that puzzle that the diagnosis is for reaching a good treatment plan. And then the execution of that treatment plan will be easier if we have the appropriate tools for working precisely in our patient's mouth. Some people says, and this is important to analyze, because I have students, I have people that maybe I meet during my lectures, and they said, you know, Jenner, the microscope is nice, the microscope is good, but I have been practicing dentistry since 20 years ago, and I have good clinical results. If you only think about clinical results, maybe you will obtain good results, but you are not thinking about the health of the dental practitioner. And the microscope, it's a tool that mostly will provide most of the benefits to the dental practitioner. And we will see why. We will start with that. The microscope, it's a tool for you guys. If you are dentists, you are going to buy the microscope because of you. And then you are going to provide all the benefits and to transmit all those benefits to the patient, because it will enhance your ergonomics. It will provide you a clinical environment in what you will be relaxed. But going back to the clinical results, this is a case managed by me. A long time ago, I will say that I performed this treatment maybe 8 years ago. The pictures were taken with an iPhone. They were taken with a cell phone, and as you can see, the pictures are acceptable. You can also notice that by that time we weren't working with digital radiographs. We're still working with the regular radiographs. And this was a complex treatment because we had a necrosis, we had a pulp necrosis, we had a periapical area, we needed to place an apical plug. And if you see the 18 months follow-up radiograph, the periapical radiolucency is not there anymore. We have a good healing of the periapical tissues. And I performed that treatment without the help of magnification. But it was very stressful. It was very stressful. It took me 2 appointments because I wanted to be very conservative. But being honest with you guys, I performed that treatment. I did that treatment almost seeing nothing. Everything was made only by tactile sensation. And I was very lucky because I managed to place that apical plug and to keep it inside of the root canal system. But it took me 2 appointments. It was very stressful. I obtained a good result. But nowadays, if I have to do a similar treatment, I will finish that in an hour and a half, maybe, or maybe in 1 hour, feeling relaxed. Because I have a good visibility, I can be relaxed, I can have a better understanding of my clinical working area, and the microscope for sure will help. And the clinical practitioners can do a lot of treatments without the help of magnification, but forcing the eyes, generating stress, not being so precise. So, and definitely there are some treatments that cannot be performed without the help of magnification, or they can do it, but the success rate will be lower. If we talk about success rates in periapical surgery, for example, without the help of magnification, a regular periapical surgery, the success rate might be around 75 to 80%. With the microscope, you will reach a success rate of 95%, which is a high success rate. So let's talk about why do we need a microscope in our office. I can think about 5 main reasons. The first one is obvious, because of magnification. The microscope can go in different steps, and the range of magnification most of times is going from 4.5x to 24x. And with small variations because of the focusing distance, the magnification in the binoculars, and there might be some small variations. The magnification is obvious, but a proper magnification cannot be properly applied if we do not have a proper illumination. And magnification and illumination nowadays, that most of the microscopes come with LED lights, we will have a very good illumination of the operative field. So these 2 things are related to the vision that we are going to have for working. And we will work more comfortable because of that better perception of the operative field. Then we need to think about the health of the clinical practitioner, because the microscope will change your clinical posture. You will have a better ergonomics for working more comfortable, and you will feel more relaxed in your eyes, because you are not going to force the muscles of your eyes for trying to focusing in the most posterior areas. and you are not going to need to go almost above the patient, very close to the patient, trying to have a proper focusing distance. So the next two, these two reasons are related to the clinical practitioner. And the fifth one is the communication. The communication that we can have with our patients and the communication that we can have with our referral doctors. In endodontics, we have referral doctors. We need to send a report about what we did. And when you add those clinical pictures, the understanding between the practitioners is going to be good. And this possibility of getting digital material related to your procedures, it's advantage that can be applied to the advertisement of your clinical practice or your office, because you can get pictures and videos in real time, and you are not going to need to stop or to interfere with your clinical protocol and with your clinical workflow. You just continue working, and the dental assistant can start taking picture when you require it. So let's see this clinical situation. We have a calculus in that area. You have two options for explaining to the patient. You can take a radiograph and show to the patient in the radiograph that there is a small dot, white spot in between the tooth, and tell to the patient, you know, I need to remove that because it is provoking gum inflammation in the area in the radiograph. Or you can have the possibility of taking one of those pictures, showing to the patient how bad it looks in the area. You can show to the patient the inflammation that is being generated in the area, and I'm 100% sure that all the patient will like to get it removed from in between the teeth, because it's not nice to see that. You can see it looks disgusting, but the only chance of having this type of pictures is if you have the possibility of having these images in high magnification. So when you want to sell the clinical treatment to the patient, you only have you have the chance to show to the patient what you can do, and you can sell an appropriate treatment plan. And most important, the patient will understand why you need to do the treatment on him. So in resume, all the reasons are focusing health. Some of the reasons are related to the health of the patient, and some of the reasons are related to the health of the clinical practitioner. We will analyze these two in detail as well. And when we combine these advantages of the magnification, we can use them for the advertisement of our clinical office and what we are doing in our daily routine. Let's talk about the communication between referrals and the endodontist. This is an interesting case because I was the referral doctor asked me to do a root canal treatment in the lateral incisor and in the central incisor. And the referral told me, Jenner, you know, we just place the crowns. The patient is in pain. And please do the root canal treatment to the patient. We schedule the appointment for the patient. And the patient told us, you know, doc, when I do this horizontal, when I touch my teeth in an horizontal direction, I feel pain. And when I brush my teeth, I can see bleed coming out. I can see some bleeding from the area. We took some pictures, and as you can see, the crowns have a lot of defects. We can see some cement in between the crowns. the patient wasn't able to even close that area. You can see that the crowns are not properly adapted in the area. And all these factors were generating the pain in the patient and the discomfort. So the reason of the complaining of the patient is not related to endo. It's related to a periodontal disease that is being provoked by the crowns and by the excess of cement that is still in between. So what to do? You cannot tell to the patient, the problem are the crowns because my colleague did a very bad job. You cannot say that. So these situations are difficult to deal with, but we already understand that we do not need to say to the patient that the referral dentist did a bad job. What we do, we just take the pictures, we talk to the patient, we explain him, I already have the clinical information that I need, but I need to discuss with the referral doctor what is the best treatment plan for you. So you will have another appointment. For now, that's it. I will have a conversation with the referral doctor, and he will be in touch with you for explaining what to do. And then you just need to send the pictures to the referral doctor, explain to the referral doctor what is happening, that the root canal treatment is not necessary, and that's it. The referral doctor will deal with that problem. And you didn't even have to tell something not good to the patient about the referral doctor. So it's a very easy way to have a good communication with the referral doctors as well. So we have been talking about all the advantages that the microscope can bring to our clinical practice. And because of that, the microscopic magnification have been applied in restorative dentistry, in endodontics, of course, in implantology, in periodontics. I can say that maybe behind the endodontics, after the endodontics, the second specialty in dentistry that is using a microscope in a more regular basis are the perios. In periodontics, they are trying to use the microscope a lot. But the problem is when you have to work in different directions and with different angulations of the microscope. With the regular microscope, that is more difficult than with the 3D microscope, because with the 3D microscope, as we will see, you have freedom of movement because you can angulate the optical pod in any direction, and you will have direct vision in most of the clinical situations. With the regular microscope that you can see here, is not that easy. You need to stay in a straight position, and you cannot angulate the microscope because it will generate an angulation as well of the binoculars, and you cannot adapt the angulation that the binoculars will take. And we will see all these differences during the next slides. So for what can we apply the microscope? As I explained you before, we are doing everything under the help of magnification. If we have deep caries, we will be able to remove the infected tissue just to leave the affected dentinal tissue in the area. You will have the chance to decide, okay, this black spot that I can see here, is it infected or affected dentin? Is it hard enough just to leave it there? Is it only a change of color, for example? And we will have the chance to be more conservative with our treatments. We can analyze even how deep we are inside of dentin, because remember, guys, that the pulp and the and the dentin are strictly correlated. That's why you call them the pulpodentinal complex. As soon as you touches the dentin, you are already generating some reactions inside of the pulp. And we can decide, okay, do I need to place a base? I am going to use a glass ionomer, maybe a bioactive material, and then we can proceed with our coronal restoration, with the adhesive restoration. The microscopes, most of them, they come with two filters. One filter is the the orange filter that help you for working with light sensitive materials like the composites or the resins. You can work with the orange filter, and then you will just need to photo cure the material for getting it hard. If you do not use the orange filter, the material will react to the light of the microscope because the light is very strong. It's very powerful, and it will react with the materials, and the materials will get hard. And the microscopes also have with a green filter. The filter helps to see blood vessels and is mostly used for surgical procedures. But the orange filter, it's very useful. And nowadays that we are implementing more and more the laser in endodontics and the erbium laser in dentistry in general, you can also adapt a filter for laser to your microscope. And you are not going to, you won't need to use the glasses for the laser because the microscope can have as well that filter. Or you can use the regular glasses for protecting your eyes and use the microscope, the 3D or the regular microscope. We have been working since long time ago in clinical research related to the regular microscope and to the 3D microscope. If you would like to read any of these articles, just let us know and we can share these articles with you. And the last one that we published, it was published in the Roots International magazine, and we made a comparison between the fine motor skills while the clinicians were using the regular and the 3D microscope. And the performance was better using the 3D microscope, and the efficiency of the doctors also was better doing using the 3D microscope, and the time that they need to perform the treatments also was better when using the 3D microscope. One important thing to mention, this study was performed with dentists that have zero experience using the microscope. So we trained them, and then we did all the tests. But we were able to notice that with the 3D microscope, it's much more easier to overcome the learning curve. It's much more easier to get used to the microscope than when the dentist is using a regular microscope. And it is very important because when you are working with a microscope and the learning curve is too stressful and the learning curve is too difficult to deal with, it might be frustrating. So that is basically what we are looking for. We are looking for precision, but we are looking for happiness as well. We want to finish our day in this manner, smiling, having fun, feeling good with our staff, feeling good with our treatments, and we need to enjoy dentistry because dentistry can be stressful. And actually, it's stressful from time to time, but we want to enjoy. But let's analyze this picture. I used to teach in the university. I teach in the university for 9 years. And this was a scenario that I have to deal with every day. And what do you think? You think she is enjoying dentistry? Definitely not. She's trying to see inside of the mouth of the patient. She's trying to do her best. And she's trying to have a proper vision. Because of that, she is in that position. And that is not ergonomic at all for her. Can you imagine working like this for 5 years? You are working like this 5 years and you are done. And they are just trying to reduce the focusing distance for having a proper vision of the operative field. And this is a story that is repeating every day all over the world with all the dentists. So we need to avoid this because this will generate musculoskeletal disorders that are going to affect you. And we do not want this. What the evidence says. This article was published by Agahin in 2018. And this is an interesting study because of one main reason. This study was performed in students from 3rd to 6th year of the dental school. They were just starting the dentistry life, their dentistry life. And 82% of these students, very young people, already reported musculoskeletal disorder and musculoskeletal pain. And it happens to me. I started feeling back pain when I was in the 4th year of the dental school. And that's not cool. That's not easy to deal with. It's not funny to work in that way. As soon, and I suffered that during the 4th, 5th, 6th grade, and then I get into the endo school. And during the endo school, I start working with the microscope, and I noticed the change. It was more relaxing to work. I started feeling less pain in the area, and I really start enjoying my clinical practice. Before that, it was not funny for me. And what areas of dentistry are the most affected? Endodontics and pedodontics. Endo, why? Because it's difficult to see inside of the root canal system. And in pedodontics, they have to work very fast. If you have a 2 years old little kid in your dental chair, you cannot spend 60 minutes with him or with her. You need to work very fast. And most of the pediatric dentists, they have to work very fast and they need to adapt bad positions for having a proper vision in the area. And one of the things that we need to have in mind is that these musculoskeletal disorders can generate even a 30% of people getting retired earlier than expected because of disability. So the ergonomics that we are going to obtain because of the microscopes are really advisable to have. You will work, the microscope will force you to have a proper position. This course, this online course is not about ergonomics. The Academy of Microscope and Health Dentistry, they have a course related focusing only in ergonomics. And if you want to learn more about ergonomics, I advise you to go to that course. Juan Carlos Ortiz Hughes is providing that course. That guy is an expert on that topic, and he will guide you about along all the tips and tricks that you need to understand and to know for having a proper ergonomics in your dental office. And everything will be related to avoid these musculoskeletal disorders. See my position. I have this clinical position for applying anesthesia in the palatal zone in a little kid. That picture was taken like 8 years ago, maybe. And with the microscope, if you have the rotational extender accessory to your microscope, you can do the same. You can keep your binoculars in a straight position, in an horizontal position, and you can move your microscope from side to side. You have a little bit more freedom of movement, but it's just a small extra freedom of movement. It's not like with the 3D that you can move the optical pod in any direction. And we can analyze something interesting. We can analyze something interesting in this picture, because before working with microscope, I started working with loops. But if you analyze the position of my neck, those loops were killing my neck. The position was even better without using the loops. If you guys are going to use loops, it's important to have personalized loops. You need to have a loops, and even better if the loops are angulated, because if the loops are prismatic loops and they have the lenses in an angulated tube, you won't have this problem with the neck. With the loops, I was seeing better, but I started feeling pain in my neck, because these loops were not personalized loops. They were just very cheap and regular loops by that time, and the microscope will change your position. But with the regular microscope, the regular microscope with the binoculars, you need to stay straight in the same position all the time, which is good, but we are not going to be free enough for performing some treatments. This is what happens with the loops. The muscles of your eyes are going to be forced, because every time that you want to see, your eyes are going to go inwards and doing this. You focus in the loops, you do this, then you have to grab a material, for example, and you look out from the tube of the loops, and your eyes are going to do this. So you are forcing the muscles of your eyes in this way all the time. With the microscope, the lenses, we are going to take care of that. You will see all the time to the horizon. The muscles of your eyes are not going to do this. And with the loops, it happens a lot. So for the eyes, you will see better, but you still forcing your eyes in some way. With the 3D microscope, you have freedom of movement. If you want to teach, it's quite nice, because you can have your students behind you, and they are going to see the same thing that you are seeing in 3D. And the most important thing about 3D is that you are going to have a better depth of field in the area, and you are going to see focus a big area in the mouth. So with the 3D, you are going to see all the time the screen that is just in front of you, and you are going to move with the screen at the same time. And let's see a systematic review, again, related to the ergonomics and to the positions that we need to perform, to have. This was published in Sultana in 2017. It is a systematic review, and if you see the numbers, it's a problem that we need to take care of. The musculoskeletal disorders in dentistry are going from 63 to 93%, which is very high. What are the most affected areas? The lower back and the neck. And we already saw some examples of why these two areas are the most affected. We are constantly moving and doing repetitive movements in those areas, and in the shoulders as well. And the musculoskeletal disorders as well. Sultana is reporting an early retirement in almost 30% of the dental practitioners. And the microscope definitely is going to help you to help us to reduce that number. That's why I say that the first one taking advantage of the microscope is the dentist. It's a tool for you. It's a tool for feeling more comfortable, for getting all the advantages. And the main problem is this. I have some friends, they already made the inversion. They decided to buy the microscope, but they are frustrated. They are very frustrated with the regular microscope. And I will stop sharing now because I wanted to show you something. So I have here, let me get this camera closer to me. I have here a regular microscope. With a regular microscope, you need to see across the binoculars, okay? And you will have an appropriate working position. But what happens? When you are working in that position, you have to see through the binoculars all the time. Now that I am talking to you, I'm seeing to the camera and I'm moving my hands, but because of my peripheral vision, I can see where my hands are located and how I am moving my hands. I'm looking to the camera, but I still having my peripheral vision. And because of that peripheral vision, my brain can have the connection with my hands, and that eye-hand coordination can be reproduced in a smooth way. But what happens when I work under the help of the regular microscope in this way, I lose my peripheral vision. At least at the very beginning of the learning curve, I am going to lose my peripheral vision. And if you don't have that peripheral vision, you are not going to know where your hands are located. And it's difficult to have fine movements and precise movements if you do not generate that eye-hand coordination. And that's the main point of why getting used to the regular microscope, it's more difficult. And it generates a lot of frustration. And I can tell you guys that I already tell you that we have the dream of having a clinical practice focusing on dentistry. My wife is in charge of the restorative area, and she never gets used to the regular microscope. She told me after 2 weeks, she told me, you know, I just quit. It's too difficult. I'm taking like double of the time that I used to take for doing a restoration, for example. I'm losing time, I'm losing money. And I explained her, you know, this is in this way. It will take you more time. And she tried for 2 more weeks. I was trying to help her to get used to that. And she just quit. And it was very frustrating to me because I understand by that time that it won't be possible to get the clinical practice focus on microscopy. Then I saw the 3D microscope. I think that I get the first one that was launched into the market, the dental market, and she got used to that very fast. After 4 weeks, she was very happy. After 1 week, she felt the difference, and after 4 weeks, she was working, feeling very comfortable with the 3D microscope. Why? Because with the 3D microscope, you are not going to lose your peripheral vision. You will see to a screen. It's like playing a video game. You are seeing the screen, you have your peripheral vision working, and you know where your hands are located. That's one of the main reasons of why the learning curve using the 3D microscope it's easier to overcome than when we try to use the regular microscope. The learning curve using the regular microscope, according to the literature, it will take to overcome the learning curve from 4 to 6 months. From 4 to 6 months, you will need to work to have the same workflow, to take the same time, to feel comfortable, to work feeling good. Maybe after the first 2 months, you are going to start feeling comfortable enough, but you still have some sort of frustration. With the 3D microscope, the learning curve will take you maximum from 6 to 8 weeks. So it reduces the learning curve from 6 months to 2 months. And after 2 weeks, you start enjoying doing dentistry. Of course, at the beginning, there are some movements. You want to move to the right side and you move to the left side. You want to move towards mesial and you move towards distal. But it's just a process. I'm not saying that the regular microscope is not good. Of course, it's good. We have regular microscopes as well. But the 3D, from my point of view, is the perfect tool for bringing the microscopy into your dental practice, and for general practitioners and for surgical procedures is the best thing. For endo, you can still use the regular one. And I'm an endodontics, but when I have to do a surgery, I prefer the 3D microscope, not the regular microscope, because I will show you that freedom of movement that we can have. So let me go back to okay. So let me go back to my PowerPoint. I will start sharing the screen again. So the first thing is that we want to be frustration free. See? Okay. So it can be frustrating to get used to the regular microscope. With the 3D microscope, what do you need to do? You do not need to do the parafocal adjustment that you need for the regular microscope, which take some steps for adjusting the microscope for you. With the 3D microscope, you just need to place the microscope in front of you, adjust the screen, and start working. And as you can see, look at the position of this patient. The position is not the best position, because the patient is kind of inclined in 45 degrees, because this patient was experiencing some back problems. Look at my position. I still having a proper and ergonomical position, even with that angulation of the patient. Why? because I have the screen in front of me and I was able to angulate the optical pod of the 3D microscope in the direction that I need. So we will work with 3D vision now after seeing all the advantages, after having a small comparison between the two types of microscopes and the general advantages that we obtain from magnification. We are going to go deeper into the 3D microscopy. So the first thing that we need to understand is that the 3D vision that we are obtaining from this microscope is a passive 3D vision. We are going to use only polarized lenses. We are not going to need the lenses that, if you remember many years ago when the 3D came into the TV screens, there were some active vision in what you need to use heavy lenses, you need to place a battery on that lenses, and it was working with a battery in the lenses. With the Promise Vision 3D microscope, we are using only polarized lenses like these ones. You can use regular polarized lenses, or these ones that can be adapted to your prescription glasses, the glasses. And my first doubt when I was making the decision of going for the 3D or not was because when I go to the cinema to see a 3D movie, after 1 hour, I start having headache, I start feeling dizziness, and eye fatigue. And I asked to the people from Siler, guys, if I go to the movies and I see a 3D movie, after 1 hour, I'm feeling bad. Eye fatigue, headache, dizziness, and what can I expect if I work with the microscope all day long? And they explained to me many things that make sense. First thing, we are not using anymore the glasses in what you have a red one and a blue one, because those type of glasses generate dizziness and eye fatigue. Second and most important thing, when it comes to 3D vision, the position of the screen is very important. In the cinema, the 3D screen is too far away from you, and it generates the headache and the eye fatigue. And another important thing, there are two types of 3D vision, negative and positive. When you go to the cinema, you can see that the 3D images are coming out from the screen, and that generates eye fatigue. The 3D vision in the Promise Vision, it's a negative 3D vision. You are seeing that the depth of vision is going inside of the screen. And that's quite important. If you compare different brands of microscopes, the first thing that you need to see is if you have negative 3D vision. If the microscope have positive 3D vision, it is bad. And you know, it's funny because during the International Dental Show this year, a friend of mine who is in charge of a company that is doing microscopes called me and told me, you know, Jenner, we are working on a 3D microscope. We know that you already have the experience with this technology. Can you please come and let us know what do you think? I went there. As soon as I saw the microscope, I noticed that the vision was positive. The 3D vision was positive. I evaluate the microscope. The idea was good because the idea was to have a 3D vision without using glasses. And it was a pretty cool idea because all the technology is in the screen. But the 3D vision was positive. And I told them, you know, guys, it looks very nice. The resolution is not as good as expected, but unfortunately, you have positive 3D vision and it will generate headache and eye fatigue and dizziness. And they told me like, why? And I just explained them why this happens. And they listened to me. They went back they did some tests, and 6 months after, they call me and tell me, Janet, thank you very much, because we stopped the development of that microscope. We saved us a lot of money that we were going to waste, and we just stopped the projects because they were not able to provide negative 3D vision with the technology in the screen that they already have, and they just dropped the project because of that. If you buy a microscope with positive 3D vision, it will be bad. You are not going to feel comfortable at all with that. So for what can we use the microscope? And here is an important thing. You can use the microscope for doing very, very precise treatment, like removing a broken file. For removing a broken file, you are going to need to go for the highest magnification, and you can do the preparation for receiving an indirect restoration, for example, which is not so precise most of the time. And you can go for very specific procedures to a more general procedures, I will say, in what you do not need very specific precision of movements. Depending on the procedures, you will choose the magnification. And let's see the next video, and let's analyze how it changes when you go from removing a broken file to preparing the tooth to an indirect restoration. So you can go from endo to resto, no problem. You can go from endo to resto, and let's see all the advantages of the 3D microscope. And as you can see, there are a lot of them. First one, no binocular head. We already analyzed why. Having no binocular head, it will give you freedom of movement. You are not going to need to be attached to this tube. You just need to see the screen. So it generates freedom of movement, and most important, it won't affect your peripheral vision. If you have your peripheral vision unaffected, you are not going to have eye fatigue, and it will make the learning curve shorter. Very important, the depth of field is greater than 51 millimeters. With the surgical 3D microscope, the promised vision, you are going to have a field of view that is wider than 100 millimeters. What does this mean? In the lower magnification, you can have in focus the upper on the lower maxilla, from the canine to the second molar, for example, because we have a very nice depth of field as well. When you increase the magnification, the depth of field will reduce, and we will see how is that change. And one of the biggest mistakes that the dentists make when they are trying to get used to the microscope is trying to work under the higher magnifications. If you try to work under the higher magnifications, you are going to be frustrated because the depth of field will decrease a lot, and if the patient moves a bit, you will be out of focus. So it's a common mistake. The dentists decide to buy the microscope, and they try to work under the 5th or the 6th step of magnification, which is 18 to 24x approximately. That is too much. For doing general procedures, we are going to work under the third step, the second, the third step most of the times, because working in that magnification will provide you a good field of view and a good depth of field, and you are going to be in focus all the time. If you are working under the highest magnifications, you will notice that you can have the tooth in focus, but maybe the burr in your handpiece is not going to be focused because the depth of field is going to be very small. So this is a good clinical tip. Please try to work at the very beginning under the smallest, the first steps of magnifications. If you are going to do a general examination, go for the first step of magnification, which is 4.5x. If you are going to do a preparation for a direct restoration, go for the third or second step. You can go even for the fourth level of magnification when you want to polish a margin, for example, that is close to the gum. You can go to that. But the fifth and the sixth step of magnification, those two are only for removing broken files, only for checking if you have a fracture, for example, just for very specific procedures, not for everything. Another advantage, you can rotate the optical pole while you maintain your ergonomic position. You can have additional outputs. As you can see, my 3D microscope, it's just behind me, and I have an extra screen. That one, it's a regular screen, and I can project all the images that I am seeing in that screen that is in the wall. So my dental assistant, she can see in 3D, in the monitor of the 3D, and if I move to maybe an uncomfortable position for her to have a proper vision, she can continue seeing in the regular screen. If you would like to have an extra 3D screen, you can also have the extra 3D screen. Another advantage, the system came with his own HD video capture and recording system. It's quite easy to record videos. You just need the remote control, and with this control, you can record videos. You can take steady pictures as well, and you can play those videos in real time. After doing the treatment, you just need the remote control to play videos in the area to show to the patient what you did. You don't need to take the memory card, take it into a computer, edit the video. You just need the remote control, and you will have the chance to show to the patient what you did, which is an important advertisement tool for you. And nowadays, guys, having a 3D microscope will make you different, will make you have a unique clinical practice, because nowadays it's not common. If you have dentists in your area and you have the 3D microscope, you can advertise you as a 3D microscopic dentistry. And it's a very nice show for the patients. And when I see young patients, for example, I invite the parents to come. I give them the 3D glasses, and I just let them to see in 3D what you are doing. And for them, it's shocking. It's like, wow, this is so nice. I have never seen this before. So it's good for advertisement as well. It comes with a variofocus. The variofocus comes with the 3D. The variofocus will help you to change the focal distance. And if you want to focus, you just need to use the variofocus. You are not going to need to move the patient or to move the microscope up and down for having a good focusing in the area. And most important, we already talked about negative and positive 3D vision. It's quite important, guys, to check that the microscope that you are going to use does not have latency. If you buy a microscope, a 3D microscope, and it have latency in the transmission of the images, it will be impossible to work with. because your brain will collapse and you are not going to feel comfortable working. You need to see the images in the screen at the same moment that you are doing your movement. If you move immediately, you need to see your movement in the screen. If you have even a very short, very small latency, it will be a mess during the clinical practice. So it's quite important. And because of the latency, many attempts for having a 3D microscope failed in the past. So there are some options in the market. You can see that there are 3D cameras. The 3D cameras have the problem that you need to buy the extra screen. And as I mentioned it before to you, the position of the screen is very important. If the screen is too far away from you, you will have eye fatigue, headache, and disease. And it's not going to be fun for you working with a screen that is too far away from you. We will see what is the advisable distance between your eyes and the screen. Some attempts for the 3D microscopy failed because of the latency, and 3D technology is nothing new. It has been in medicine since long time ago. The ophthalmologists, they use the 3D technology since long time ago for doing surgery in the eyes. The neurosurgeons, they were already using the 3D microscopy because of the depth of field. The depth of field is quite important for them because they are working in structures that are smaller than the structures that we are working on. But what's the problem? The price is one problem. Maybe a microscope for neurosurgery or for ophthalmology, it will cost $500,000. And $500,000 is not an inversion that a dentist wants to make for having magnification. And you can see that those microscopes are huge. Maybe you will need a very big operative room for having one of those. And the screen is not integrated to the microscope, which generates a problem. You can see the surgeons here working in an eye, and the microscope is in front of them, in between them and the screen, and it is generating distractions in the area. So it's not a new technology. What is new is that Seiler managed to bring this technology into dentistry, which is a big accomplishment. So let's analyze the distances. This is how we work here in the office. You see that the screen is just in front of me. The proper distance for having the best quality of 3D images and for being relaxed during the full procedure is 60 centimeters. And the distance between your eyes and the mouth of the patient, it's around 55 to 60 centimeters as well. If you go farther than that distance, it won't provide you high quality of 3D images. Another important factor, your eyes should go straight to your vision should go straight to the center of the screen. So your vision should hit the center on the screen in a 90 degrees angle, in this way, for having the sharpest 3D images. Of course, if you are not seeing to the screen in a sharp direction at 90 degrees to the center, you're still seeing in 3D. You're still seeing in 3D. But there is a small difference that can represent a problem if you are working removing a broken file, for example. We don't need to work in this way. Look at this doctor, 20 centimeters away from the mouth of the patient. And during the pandemic, we understand how important it is to have a proper distance, a safe distance, a biological safe distance from the mouth of the patient and our head. So I will stop sharing now because I want to show you the movements of the optical pod. Here is my 3D microscope. Okay. Let me take my computer to, I will move this to here. Yeah, we are better here. Okay, I have the optical pod here. I can change the position of the handles. For me, this position is the most appropriate because it's not interfering in your way of movement when it's exchanging instruments with the dental assistant. This is the optical pod, is where we change the magnification, where we use on select the filters, and you can angulate the optical pod in any direction. Okay? And the screen of the 3D microscope is just in front of me. For example, this is the best angulation and position of the 3D screen for me. I mentioned it to you that my vision should hit the center of the screen in a 90-degree angle. But if I need to change the vertical angulation of the screen, you can change it. And this is for obtaining, for making to you easier to obtain the sharpest images in the room, in the screen. So you can change the vertical angulation of the screen, and you can also change the vertical position of the screen. It comes with a motorized system. As you will notice, the screen is going up now. And I can take the screen going down as well. So this is a motorized system. The vertical angulation of the screen, you can change it with, it is a manual system. It's not motorized, but we will manage that for having the best quality of 3D images. What you need to do, guys, I give courses about 3D about microscopy and 3D microscopy. And for my students, it's quite easy. They just need to turn on the microscope, sit to the center of the screen, and that's it. Piece of cake. There is not a lot of tricky steps to perform when adjusting the microscope to the student or to the clinical practitioner. So we have the screen integrated to the 3D microscope. And it's important to notice, let me check. It's important to notice that if you move in any direction, the screen will follow you. The screen will be in front of you all the time. So you can move in any direction, you can move the optical pod in any direction, and you will have your proper vision just in front of you. What my wife needs to do when she works with, they just need to change the vertical position of the 3D microscope for having the best quality of images. And that's it, no parfocal adjustment needed for that. So it's quite simple and quite easy. And the position, as you can see now, I'm working with this ergonomic chair, which have a back support, arm support. It's very comfortable to work with. It provides support to the arms for working in this way, and it decreases the possibilities of having musculoskeletal disorders in the shoulders and in the elbows. So it's advisable to have this type of chairs as well. But even without those type of chairs, you can see that my position by that time when I was just starting with the 3D microscope, it was a good position. We already talked about the variofocus. The variofocus will change the focal distance. And as you can see in the video, we recorded that video with the 3D microscope. You can see that the focusing is changing from inside of the root canal, where we can see the gutta percha inside of the root canal, or to the floor of the pulp chamber, or even you can go towards coronal and focus the occlusal surface. And that is possible to do only moving the knob in the variofocus. If you do not have the variofocus, you will need to move the microscope up and down or the patient, which is not nice because we already talked about the musculoskeletal disorders, and they are provoked because of repetitive movements. And I'm doing this with the microscope many times per day, I will start having pain here. If I move the patient many times during the day, it will generate problems in some area of your body. So the variofocus helps a lot. Another thing, and this is a tip that I advise you to take into consideration, the type of mirrors that you use. You have in the picture of the right side, rhodium mirror. We took those two pictures with the same camera, the same microscope, the same light, the same configuration in the camera. We only changed the mirrors, the dental mirrors. In the left side of the screen, we use some rhodium mirrors, very expensive mirrors. And in the right side of the screen, you can see an image where we use HD mirrors. The brand of that mirrors is, let me see, and I can type it in the chat. These are Cirque mirrors. Cirque is not paying to me for saying this. I just believe that these mirrors are some of the best in the market nowadays. Let me go back. And you can have sharp illumination of the clinical area. And for the 3D microscope, my best experience is with that Cirque mirrors. And these are very cheap mirrors. They cost like $4 US, and they get scratched very easy. But if you take a proper care of them, maybe you can protect them with a gauze before taking them to the sterilization process, and you can notice the change. You have a much better illumination inside of the pulp chamber when you have HD mirror, or if you have cheap mirrors of other type of mirrors. Just give them a chance. So this is very important, guys. It's very important to understand what steps of magnifications are we going to use. Because let's look at this chart in what we have: the magnification, the field of view, and the depth of field. When you are working in the lowest magnification, which is 2.5x in any microscope, not specifically in the Promise Vision, your field of view is around 100 millimeters, which is huge. And your depth of field is around 60 millimeters. It means that you can have in focus from the canine to the second molar, approximately. See, if the patient is a small patient, maybe the full arch. But let's see what happens when you go to the third step of magnification. The field of view reduces 50%. You go from 100 millimeters to 50 millimeters on the field of view. It reduces a lot. But let's look to the depth of field. The depth of field reduces almost to 1/3 of the depth of field that we used to have in the first step of magnification. If we go to the second step of magnification, you go from 61 millimeters in depth of field to 25. which is a big reduction. That's why it's a big mistake trying to work in the higher magnifications. You are going to be frustrated if you want to do your procedures at the 6th step in 20x or 24x. Your patient will move a bit and you will be out of focus. If you work in the 5th step of magnification, you will have maybe the molar will be in focus or the anterior teeth will be in focus, but if you try to use the mirror, in the mirror, you are not going to have a good focusing in the area. Or if you are going to use the board, you are going to have a good focusing on the board or on the tooth, not both at the same time. So the first steps of magnification, guys, are doing for an orientation and an initial inspection of the area. If you are going to do your diagnosis, to do a prophylaxis, for example, if you want to do an extraction of any tooth using the microscope, work with the first or maximum second magnification. For doing your general procedures, preparing a tooth for a direct restoration, a root canal treatment during the instrumentation and irrigation process, if you are going to prepare a crown for a tooth for a crown, work between the second and the fourth magnification, but never go to the 5th and 6th level of magnification. Those levels of magnifications are for detecting fractures, for polishing very specific areas. If you have some excess of cement or sealer in some area and you want to remove it, if you want to remove a broken file, you can use the highest levels of magnification. Otherwise, please stick to the first, second, third, and fourth level of magnification. And most of times we are working under the second and third level of magnification. Then we go to the fourth and go back. Okay, so please pay attention to that because it will make a big difference when you are working on overcoming your learning curve. Of course, when you are already used to the microscope, you are an expert using the microscope, it won't be any problem for you. If you want to do a preparation for a direct restoration, I can do it in the 5th level of magnification, but it's not that comfortable. We are going to use those magnifications for very specific procedures. For example, look at this. We are doing the extraction of a third molar there. We don't need this magnification. We have the patient on risk because we are not analyzing and we are not taking care of the adjacent structures. So it does not help us to work in that level of magnification. You see, the patient moves a bit and is getting out of the field of view. And the patient moves a bit and you go out of focus. So for this procedure, it's not necessary to go so high in the magnification. Of course, if we need to remove a broken file, we will go to the higher steps of magnification, but please notice something in the next video. In this video, I was working with the 3D for removing a broken file, and you will see that I managed to have the broken file on focus. The broken file is in focus, and I can see that millimeter of the file in the one I'm working on applying ultrasonic force. And you will see as well that at some point I break the ultrasonic tip because I applied too much force and I broke the ultrasonic tip. But you will see that when I take out the broken file, it immediately goes out of focus because I'm working in too high magnification. So as you notice, we were able to perform a very precise treatment, but the focusing, the depth of field will reduce as well. As you know, we have many new devices in the market related to digital dentistry, but all this technology, when we analyze the success rates before any new technology and what we used to do, most of times you will notice that the success rate is the same. Most of the advantages of having this technology as related to the comfortability of the clinician. Now it's much more easier to be a dentist. But the clinical microscope, the operative microscope in general, it's a tool, it's a device that really helps us to increase the success rate of our treatments, and it is evident when we think about microsurgery. The success rates of periapical microsurgery before the microscope, it was around 75%, according to some reports. Nowadays, we have a success rate of 95% in periapical surgery, which is the same success rate of a regular root canal treatment. Why? We have more precision, we have better abilities for providing a proper diagnosis, and it was the problem when we look into the past. The clinicians didn't have the ability to detect fracture, for example. If they perform the surgery and they did not detect a fracture, the treatment for sure will fail. If they didn't have the ability to check inside of the root canal system for properly placing a retroobturation, the success will fail. So because of that, the microscope will enhance your clinical success rates. And the microscope is helping us on that. It also helps in the healing of the soft tissues. The periodontists are using the microscope. Why? Because with the help of magnification, we use 6-0 and 7-0 suture. And it has been demonstrated that the scarring that can be present in the area is related to the ability of the clinician and is related to the tension that we place in our suture. When you have a 6-0 or 7-0 suture, and you try to apply too more pressure for making your knots, if you apply too much pressure, you will break the tissues. And with this type of suture, we need to be very gentle and just to approximate the border of the flap with the border of the steady tissue in the area, and you will have a better healing. And this is possible because of magnification. If you try to do some suture with a 7-0 suture material without the microscope, you don't even see the suture material. It's too small. And the microscope is helping us to have better results. So I will go, guys, to show you some slides related to what I'm talking about. Look at this. After a surgery, we place the suture here, 7-0 suture in the area. This is the clinical scenario after 3 days. We remove our suture after 3 days because the suture will create some inflammation in the area and we want to remove it as soon as possible. After 3 days, the tissues will be stable in the area. And the picture in the left side, you can see small scarring, but it's just 1 month after the surgery. After 3 months, you will see nothing. And we are able now to see that because I took that picture in high magnification. Otherwise, you don't even look at that. And when you work, I do my periapical surgeries working with my wife. You have your colleague just beside you seeing what you are doing. And you can have an exchange of ideas in real time and analyze what you think. Maybe it's better to go in this way, it's better to go in the other way. Two heads always will think better than one. and you can have that communication at the same time. What we look for is to have healing in the area. You can go for a microsurgery in this canine. You can see that we prepare a long retro preparation, a long retro obturation. We get in touch with the post that was already placed there. We were very close to the apex of the lateral incisor. We were very close to this implant in the area. So it was a challenging surgical procedure. We managed to do that surgical procedure, and after 3 months, you can see that the periapical area is healing, and it is possible because of the magnification that we have in the area. That is what we are looking for. Let's go for some clinical tips. I will play a video for you. I will go. You can see this video in the social media of Siler as well. But I want to explain you guys some specific areas or specific parts of this video, because this video have some useful clinical tips. So this video is like a resume of what we have been talking about.
The Promise Vision 3D surgical microscope is an excellent tool that will enhance the clinical abilities of the clinician. In this video, I will show you the most important factors to have into consideration for having the most comfortable clinical experience. For having the best quality of 3D images, the screen should be located just in front of the operator, in a distance of approximately 600 millimeters. The vision of the clinician should hit the center of the screen in a perpendicular direction. One of the most important and useful characteristics of the Promise Vision 3D microscope is the fact that you can angulate the optical pod in any direction. With this feature, you will be able to obtain direct vision for almost all the procedures. It is important to have in mind that the clinician will have unlimited possibilities related to the angulation of the optical pod and the patient positioning. During the next minutes, I will show you some examples related on how to angulate the optical pod, on how to position the patient for working in some areas of the oral cavity, but these are just examples. The final setup will rely on the procedure to be performed. The space that the microscope is going to occupy in your office, it's a factor to have in mind since the very beginning of the planification. For example, in our office, we have the floor model of the 3D surgical microscope, but this will need some extra space. If you have limited space in your office, or if you want to avoid any interference coming from the position or the location of the microscope, you can choose the high wall or the ceiling mechanisms for attaching the microscope and for having it in the proper positions for working comfortably. Everything will depend on the design of your office, and you can check the different alternatives with your silent representative. one of the basic
Okay, guys. One important thing when you are working under the help of the microscope is to learn where to position the mirror. One big mistake is trying to position the mirror in the same way in what you used to position the mirror without when working without a microscope. When you are working with a microscope, you need to place the mirror as far as possible from the working area. And some useful point of reference might be the opposite lip of the area in what you are working for. For example, if you are working on an upper premolar, the mirror should be positioned at the level of the lower lip of the patient. And you will see in the video that if you are too close to the area in what you are working, the mirror will get very easily full of water drops, and you will need to clean that mirror every time after 5 or 6 seconds, and that generates repetitive movements in your wrist. And please remember the musculoskeletal disorders. You will lose time as well. It won't be comfortable. So try to keep your mirror as far as possible from the working area. The microscope will become an extension of your eyes. So the microscope should be directed to the mirror. So the first thing that you need to detect is, it's okay, I will position the mirror here, and the microscope will go to the mirror when you need to use it. Because I already explained you that with the 3D microscope, you can have direct vision almost all the time. You will see in this video that it's possible to do an access opening in an upper molar with direct vision. You just need to pay attention how to position the head of the patient and how to angulate the microscope.
principles when working with mirrors and the microscope is to place the mirror as far as possible from the working area. If you are working in the upper arch, the lower lip will be your guidance for the placing of the mirror. Ask the patient to open as big as possible and use the lower lip as the point of reference. If you follow this basic principle, you will be able to position the mirror in different angles, and you will avoid to get the mirror full of water drops that will interfere with your vision.
Another important thing is that you need to select the position of the mirror. But for example, if you want to see the palatal wall of the tooth or the buccal wall of the tooth, we are not going to change the position of the mirror. You just need to change the angulation of the mirror, and you can angulate in different directions without moving the mirror from that position, and you will manage to obtain the vision that you need. You can angulate the mirror, and you can angulate your hand piece as well for having a proper vision of the area.
For working in the lower maxilla, there are two options. The first option is to work with direct vision and use the mirror only for checking the progress of the tooth preparation.
That I was about to start speaking in Spanish. That is the position that you need on the patient. They need to take down the chin and the position of the head of the microscope when you want to have a direct vision in a lower molar. it's comfortable, but sometimes it's needed to use the mirror as well, depending on what you are doing and what you want to see inside of the tooth.
But you
Oh,
often
sorry,
see
I
your
moved
tooth,
this.
the progress of The second alternative is to work using indirect vision. If you want to use indirect vision in the lower maxilla, you will need to move the mirror in the direction of the upper lip. In this case, the upper lip will be your point of reference for avoiding the mirror to get full of water drops. If the clinician needs to work in the most posterior areas of the lower maxilla, for example, in the distal area of a second molar, the 45 degrees angulated handpieces are very useful. They will provide you a clear vision of the operative field, and you can angulate them in any direction, buccal, mesial, or distal, to obtain a proper direct vision of the operative field. Would you ever imagine doing an endo-access opening in an upper first molar with direct vision? Sounds crazy, but yes, it is possible. In this video, you are seeing an endo-access opening being performed with direct vision in an upper first molar. Then you just need to use the mirror for checking that everything is okay at the level of the pulp chamber floor.
That's what I mentioned to you. It's possible to have direct vision even in the upper arch. You just need to ask the patient to move the head backwards and to angulate the microscope in that direction. You can do it to the palatal side, to the buccal side, to the lingual side, in almost in any direction. That's why when we are performing surgery, this microscope it's so convenient and easy to apply. Okay, guys, we are almost just in time. As I mentioned it to you, that video is like a resume of many things that we have been talking about. That video have some clinical tips and tricks. It's around 12 minutes long, but I wanted to mention it to you personally, the importance of understanding where to place the mirror, and that you, as when you detect where you need to place the mirror, don't move it. Keep it in that position and just angulate the mirror for trying to obtain a proper vision in the specific area in what you are working on. So the message for you today, guys, is that the 3D technology brings many alternatives, comfortability, freedom of movement. It will help you to avoid all the musculoskeletal disorders that you can have. it's easier to apply in general procedures, marginal adaptation, periodontal treatment, surgical incisions, root canal treatments. Any procedure in dentistry can be performed under the help of magnification in general, but with the 3D microscope it's much more easier to do. So I encourage you to check this technology. If you already have the technology, and if you are feeling that maybe you are having any type of difficulties, please feel free to contact me. Here is my email. You can follow me on social media as well. We can have a communication there. It will be my pleasure to help you if you need my help in the future. And that's it for now. We have a couple minutes for questions. If you have any question, please let me know. If you want to check the full video that we were analyzing a few minutes ago, just go to the Seiler clinical page or Seiler social media, and you will be able to see the full video with more tips and tricks that we need to take into consideration. Or if you want to contact me later, please feel free to do that.